Good morning and happy Monday. This is Dr. Yonette coming to you with another episode of Baby Talk. I know you're ready and energized to take on the new week and to move baby to the next level as you work with him or her to get him through his developmental milestones and to have him explore the wonders of life here on earth. So today I want to talk with you about eczema, a condition that affects 10 to 20% of all infants. And you may have realized that perhaps your child has eczema. So let's talk a little bit about it and see what we can do to help you through this process. So eczema can show up as something that looks like a crusty or flaky patch on your baby's skin, and it's often seen during the very first few months of birth. It's common, and like I said, it happens in 10 to 20% of infants, and it's treatable. The good news is that most of you can expect that your child will grow out of eczema. So if you're not sure if your baby has eczema, your baby is itchy, there's an irritated rash, and you're trying to decide whether that's eczema, you can talk with your doctor. Tell your doctor what you're seeing. You know, you've been journaling and you've noticed it repeatedly that your baby is itching and he has this rash. Talk with your pediatrician and let him help you work through what is happening. Today, I am sharing with you information from WebMD and from some other sources. So let's get right into it. What does eczema look like? Eczema, as in many other cases, looks different or may look different in different babies. If your baby has light skin, the eczema would look like patches of red skin. If your baby has darker skin, then the rash may look purplish or brownish or even grayish. And then if your baby is much darker, it will be harder for you to see that there's eczema on your child's skin. But he or she would have the itching that would normally come with this condition. Now, the patches that I was referring to would be always dark or itchy or rough. So that's how you're identifying eczema in your child. Babies can get the condition anywhere on their bodies, but most often you would see it on the cheeks and the joints and their arms and their legs, sometimes on the hands as well. It is easy to confuse eczema with crater cap. And so when you are talking about crater cap though, crater cap is much less itchy and irritable. So it is generally, when you talk about crater cap, you're looking for it to cover up, it be on your baby for up to about 8 months, and then it appears on the scalp and the sides of the nose and the eyelids and the eyebrows. So that's crater cap. But with eczema, it's totally different. So let's talk a little bit more about it. What may cause eczema in your baby? Eczema runs in families. So if you had a parent who had eczema, it's likely that your baby can get it too. There's another cause for eczema, which would include problems in the skin barrier that allows moisture out and germs in. And then the third cause of eczema can be that eczema happens because your baby's body makes too few fatty cells that are called ceramides. If you don't have enough of them, then the skin loses water and becomes dry. So would your baby's eczema go away on its own? Most children, like I said earlier, would grow out of their eczema before they start school. but it's not common to have eczema into adulthood. They may have times, there may be a few children who may continue to have eczema, but it's not common. Let me say this again. It's not common for them to have it during adulthood. They may have the child may have times when even years when the child goes without symptoms, but then there's a flare up and the skin remains dry for a long period of time. Now, there are situations or conditions or factors that may cause your eczema to get worse. And let's look at some of these factors. Dry skin. If the skin, your baby's skin is dry, it's going to be itchier. So you want to have low humidity, especially during winter months. When you have to keep your home heated, make sure the air is dry. If the air is dry, this is going to cause an irritant to your child and increase the chances of him or her having the eczema flare up. Now, the next thing that you want to consider is irritants. Irritants, think of things like itchy, scratchy wool clothes, polyester, perfumes, body soaps, and laundry soaps. These are all things that can trigger symptoms of your eczema in your child. Stress. Children with eczema may react to stress by becoming flushed. And this can also lead to them becoming itchy and having irritated skin, and that can in turn ramp up to eczema symptoms. I've known many children with eczema, and sometimes it's so frustrating for them because they're itching all the time and they scratch until they bleed. So heat and sweat can also cause that itching and make your eczema worse. And then allergies. It's not quite certain, but some experts believe that removing cow's milk and peanuts and eggs or certain fruits from your child's food or your child's diet can help control eczema symptoms. Remember that your baby can get exposed to these foods in their mothers in what their mothers eat before they breastfeed. So find out if there's a connection between these foods and the flare up of eczema in your children. So how do you treat eczema at home? You want to give your baby's skin some TLC. That's the first step in treating eczema. Try moisturizers. One of the best options is to use moisturizers. These moisturizers are available over the counter by prescription. And then, if you're looking for a good moisturizer, make sure it's fragrance-free, a fragrance-free cream or an ointment. Petroleum jelly would be great. And you should use it several times a day. And this will help to keep your baby's moisture in the skin. And you want to also to apply it after bath. Now, when you're bathing your child, you want to use lukewarm and not warm or hot water, because the lukewarm water would help to hydrate and cool the skin. It may cause some itching though, but make sure the water is not too hot. Keep the bath short, no more than 10 minutes, and then you want to soothe the itchiness by trying to add oatmeal soaking products in your baby's bathtub. You can also use, there's an oatmeal soap that you can use for bathing time. You want to use mild, unscented baby and laundry soaps. So get rid of perfumes, deodorants, antibacterial soaps. All of these can be rough on the skin, so you want to make sure you're not using them. Then when you're cleaning up your baby, clean your baby carefully. Make sure you're only cleaning With soap, you're using soap only in those areas that tend to get dirty, like the genitals, the hands, and the feet. And then for the rest of the body, just wash off the body with water. And then when you're finished with the bathing, you want to dry your child by pat drying the child. Don't rub, because rub will irritate the skin more. Pat dry the child and then dress him or her for comfort. Avoid the irritating clothes that rub against the skin, and so your child should wear loose cotton clothing. Always, always wash your child's clothes before you put them on, and use a mild, fragrance-free detergent. You want to keep your little one comfortable, and don't overdress them with too many blankets as well, because you're going to get that heating taking place. You want to keep your baby as cool as possible, because when they heat, they become sweaty, and this can trigger a flare-up of the eczema. So today, we are talking about eczema in your baby. If your baby is itchy from having the eczema, you want to keep your baby from scratching the skin, because scratching can make the rash worse and lead to infection, and also make the skin thick and look more leathery. So trim your baby's nails often. Trim the nails often. Take off the edge with a file. Take a little file and file your baby's nails. And you also want to, as much as possible, put mittens on your baby's hands. So when he or she, mittens, socks would work also. A long sleeve shirt that covers over the hand will work, so that tendency to start itching or scratching is taken away. And even if he or she does that, the nails aren't exposed to irritate the skin. And then for some children, you may have to medicate your child using over-the-counter products such as hydrocortisone creams and ointments. And when you do that, you want to target the itchy area and the inflammation. So always check in with your doctor. And when do you want to do that? You want to make sure to call if your baby's eczema doesn't begin to get better within a week of starting an over-the-counter hydrocortisone cream. Okay? So you've been using the cream for a week and the eczema is not getting better, check in with your doctor. You also want to check in with your doctor if you are noticing a yellow or light brown crust or pus-filled blisters appearing on top of the eczema. Okay? If you see that yellow-brown crust, it may be an indication of a bacterial infection, and so your child may need antibiotics at this time. So make sure that as you are taking care of baby, you are continuing to journal. If you are noticing that these signs of eczema exist in your child, you're taking the steps that I mentioned earlier to help your child through the process and to prevent flare-ups. And then if you are noticing that after a week of treatment your child is not getting better, you want to connect with your child's pediatrician and get the advice or the medication that your doctor will recommend. This is Dr. Yonette, thanking you for joining me this morning and thanking you for sharing with me your experiences of raising your new baby. I encourage you to take care of baby by being knowledgeable and by giving him a loving, caring environment to grow and thrive in. But first, take care of you. Take care of who you are as a person, how you look in your appearance. Take care of your skin, as we are talking about eczema this morning. And have the knowledge you need to give your baby the best options for success. Have a wonderful day.